If you are a brand new nurse and you often feel like you are totally and completely failing, then this video is for you. My name is Jessica Smith dos Santos. I have been a nurse for almost 20 years. I don't feel old enough for that to be true. However, it is absolutely true. And I have the absolute blessing of working with new grad nurses and having conversations with new grad nurses across a lot of platforms, across a lot of contexts. And there's one thing that I hear from most of them that I talk to, and that is that they feel like they are failing. And I'm talking brand new nurses right out of school. Maybe they've been a nurse for 3 months or 6 months, even up to a year and a half. They are really struggling with these feelings of like, I am failing at this profession. First of all, if that's you, I want you to know that you're not alone. And the purpose of this video is to give you 5 tips to deal with that feeling of feeling like you're failing in the profession. So, tip number 1 is know thyself. So, what I want to share with you is the profession of nursing and the system of healthcare is very much designed to protect itself. There are policies, there are procedures, there are processes, there are key performance metrics that the system needs you to meet in order for it to be profitable, productive, protective of the patient, protective of itself and its own systems, right? Those things are in place for a reason. And a lot of times, the feedback that you get is not the things that you're doing well, it's the things that you're falling short on, the metrics that you're missing, the feedback that you're getting from whoever you just passed the patient off to. And a lot of times, because of the pace of what we do, you can do 150 things right. But the thing that you hear from leadership, from coworkers, from your charge nurse, from the lab, from insert thing here is that, oh, you missed this thing. So when you hear that all day long, you start to get the message of like, I suck. I'm obviously failing because what I'm hearing from those around me is that I'm missing things. I'm falling short of the mark. I'm not hitting the metric, right? And that can feel very defeating when that's the only feedback that you're getting. And the reason that I tell you tip number 1 is to know thyself, because the metrics might be triggered on the other side, alerting somebody to give you that feedback. But what they're not seeing is all those incredible things that you've done all day long for your patient. And you know the truth about all the amazing things that you've done. You know that you've been a light. You know that you double checked those medications. You know that you communicated with the doctor. You know that you pulled that patient's pants down and checked their behind for skin breakdown. You know the truth about the care that you've given. And when you can stand firmly on the truth of what you know about yourself, the feedback that you're getting can be seen through a lens of opportunity rather than a lens of, I suck, I'm not worthy. And I have to just tell you honestly from the heart, for a long time, because of my own life path, I actually really struggled with my own self worth in life. And the feedback that I got in nursing compounded that ineffective habit of thinking. And what it took for me to break free from that pattern was to seek out coaching, was to seek out other ways of growing my own self-worth, of untangling identities, right? Like identities that I had taken on that were lies about myself, and really leaning into the truth of who I was. Like I had to go seek outside help in order to untangle those things for myself so that I could show up both in my life and in my profession very differently. And when I was able to know myself at that level and really reconcile my true self worth and kick the lies to the curb, I was able to receive that feedback from a place of like, okay, I have an opportunity to grow here. It doesn't mean that I suck. It doesn't mean that I'm failing, but it does mean that I have an opportunity for growth. So I was able to flip the script on how I viewed that particular piece. And what I want you to hear is I know that I know that I know that you are doing way more things right than you are doing wrong. You are not failing in your profession, even though the feedback might tell you that you are, even though you might have a habit of thinking that's being reinforced that might have you believing that you're failing. It's not true because I know for a fact by watching the new grad nurses that I work with, by the open conversations that I'm having with new grads that I don't get to work with, that there are a million things that you're doing right. Okay. So I want you to know that when you know yourself, you're going to be able to see that feedback from a very different perspective. Tip number 2, know your allies. Now, in the world of adulting, one of my personal biggest disappointments was that there's more backstabbing, more gossiping, more talking behind people's backs, more taking people's words and twisting them into things that they didn't mean and then repeating them to other people. And that I'm not even talking about the nursing profession. I'm talking about adulting in general. That was one of my biggest disappointments when I became an adult because all that crazy stuff that happens in high school, like the Gossip Girls and the Mean Girls Club and all those things that I just couldn't stand. Like I was under the misunderstanding that those went away when you became an adult, but they don't. And so when you get into the profession of nursing, one thing that's going to be really, really important to you is know your allies. And what I mean by that is know those people that work beside you who see all the things that you do every day and who can speak truth into you. When the system is telling you, you missed this mark, you didn't do this thing, you didn't document this thing, the nurse that you passed the patient to said that you missed this, you didn't do this, the patient has a complaint about this, when all you're hearing is all the negative things, you need somebody in your corner who can see both sides, who can say, yes, I did see that you made that mistake, but what I also saw was all these other things that you did well. Because if you're in a place where you don't know thyself and you're still walking through the journey of reconciling your own self worth and you're taking that feedback very personally, you have to have somebody in your corner that can speak the truth to you. And it may be your boss, it may be your educator, it may be another new nurse who's working beside you, it may be a seasoned nurse who's speaking into your journey, who cares about you becoming confident, competent, and independent. It may be somebody in another department that you've passed a patient to many times who sees all the good things that you do. But regardless, be very, very, very careful who you choose to go to for feedback. Because in the world of healthcare, not everybody is an ally. And know your allies. Know those people who are going to have your back, who are going to speak into your journey, and who are going to lovingly invite you and call you up rather than calling you out to trigger guilt and shame. They call you up into an invitation to grow because they believe in you and they see all the good that you do. It's so incredibly important to have an ally in your corner that you know and that you trust and that you can check in with on a regular basis when your mind is getting out of control and all you're hearing from the system is that you're failing, and all you're hearing inside your own head is a repeat of all of those words. I'm failing, I'm failing, I'm failing. You have to have an ally in your corner. Maybe it's even a nursing instructor who has seen how well you operate that you're still in touch with. Whoever that person is, make sure that that person knows the truth of you and is willing to speak into you in ways that call you up and invite you into the next level of both the human and the professional that you are and that you desire to be. Tip number 3, know your skills gap. So there's a very big difference between the skills that you learned in nursing school and got to practice on patients in a clinical setting and the skills that you need to know to do the job that you just got hired to do. So I got the absolute pleasure of having incredible mentors in the real world when it came to learning how to start IVs. I learned some incredible tips and tricks on patients who were difficult starts. And I was able to grow an incredible skill set on starting IVs on adults who are difficult sticks. Now, I decided to shift into pediatrics. Now, I told you I've been a nurse for almost 20 years, and I shifted into pediatrics about a year ago. And all of those incredible skills that I had were a foundation, but they did not all translate into the skills that I needed to start an IV on a 1 day old baby. There was equipment out there that I didn't even know existed. I had no idea a 26 gauge IV existed until I saw a NICU nurse bring one down because I needed help starting an IV on a 1 day old baby. Right. So I recognized right away that I had a skills gap. What I knew did not translate to what I needed to know in order to do the job and function in the role that I was currently functioning in. And this is another area where you might be tempted to say, I suck and I'm failing. Because guess what? There was a good, probably 4 weeks where I had to call somebody else in the department. I had to call the PICU. I had to call the NICU. I had to call the PEDS floor. I had to call in backup to support me in starting IVs and drawing blood on my teeny tiny babies, on my rowdy toddlers, because there were tips and tricks and skills and nuances that I didn't learn. Or if I did learn them 20 years ago in nursing school, they were long gone. And I needed to know my skills gap. And I needed to be willing to ask for help to learn those new nuances in skills. Also, in inserting like Foley's, like doing straight casts and little tiny baby girls, like where the heck is the urethra in all of that? Right. So here's one tip. Like I'll just do a little side note that one of my doctors taught me that I will never ever forget. On an infant girl, look for the flower. The urethra is right above the flower. And he did this with his lips. Right there. Right above the flower is where the urethra is. So now when I clean, I look for the flower and I know the urethra is right above and down. And I have never missed since. That's a skill that I didn't have. There was a gap in what I knew and what I needed to know to do the role that I was in. So when you're in those moments, I want you to avoid feeling like you suck and like you're failing, but lean into recognizing, oh, this is just a skills gap. There are some things that I need to learn, some nuances that I need to be taught. And this is my invitation to start asking questions. And this is where you need to know your allies. The physician that I was working with, what I had learned about him was that he also had a pediatric nursing background, which meant that when it came to nursing skills specific for pediatrics, the man had the goods. But not everybody knows that about him. And he can be a little gruff and he can feel a little difficult to approach. But when I knew that about him and I approached him in such a way that said, hey, I recognize this is my knowledge gap. I know you have the goods and I want to be a really good nurse, not only for you, but for the patients that I'm serving. Will you please come and teach me how to do this so that I can be really good at my job? He was absolutely willing and he has been in my corner ever since. If there's anything that I need skills wise that I'm not feeling comfortable with or doesn't feel quite right, and he might know a nuance, I know that he's my ally. I know that he's got my back in the skills gap. Okay. Tip number 4, know your knowledge gap. So I was chatting with one of the new nurses that I was working with, and I was like, what is your biggest challenge about being a new nurse? And he was like, the knowledge gap. What I learned in nursing school was very general. And what I need to know in this setting is very specific. And I didn't learn all the things that I need to know in this setting, or the things that I did need to know. It was more of like a general gloss over in the middle of everything else that we learned. But I didn't learn it at such a level that I truly understand how to leverage it at the bedside. And that makes so much sense to me because, yes, you learn very, very general, and then you learn more niche and more specific. But as you grow in your career and take different opportunities and work for different hospitals, what you also learn is the way they do it at one hospital is not the way they do it at another hospital. And that's where policies, procedures exist to show you, like, yes, this is the general, like, what sepsis is, the different types of sepsis. But at this hospital, these are the evidence based goals that we need to meet. And this is how we do them. And this is what we need you to document. So, in that knowledge gap, you recognize, like, oh, what I learned in nursing school is not what I need to know for here. And your very, very, very best friend is your policies and procedures. And I know they're super duper boring, they're super duper dry, but I promise you they will save your bacon. And I talk to the new grad nurses that I work with a lot about this topic is that in a court of law, saying, well, I don't know, is not going to save you. If you can say, here's the policy, here's what it says, you can see by my documentation, I did 1, 2, 3, 4, 5, exactly as it says, as evidenced by, you're good to go. And a lot of times in a real world situation, there's a lot of pressure to just like, hurry up, just do it, just do it. But I promise you that if you take that pause and you ask, where's the policy? Show me how to do this correctly. You're going to show up saying, I realize I don't know this, but I'm willing to learn. And it's going to go a long way, not only for the people that you work with to show that you're dedicated to growing the knowledge and the skills, but it's also going to go a long way for your patient because they're going to recognize that you're willing to say, pause this train just for a second. I want to do what's safe. So don't be afraid of that knowledge gap. I also just shared that I've been a nurse for 20 years and now I'm specializing in pediatric ER. If you've ever done pediatrics, you know that every age group has a different range of vital signs that are normal for that age range. Like a 17-year-old is going to have a very different normal blood pressure and heart rate range than a 5-day old. Completely different. So when I very first started, what I did is I printed out like the vital signs reference for each age and stage, and I laminated it and I literally had it on my computer. And every time I input a set of vitals, I looked at the age and I compared it to what was normal and what was abnormal. So I leveraged my tools to fill in that knowledge gap until it started feeling more natural, right? So just know what tools you have. So another gap of mine is I'm not comfortable with hanging drips on very critical patients. Like I don't know where to start with norepinephrine and like I don't know what range to start at. I don't know how often to titrate. I don't know by how many mics per minute. It's not something that's like normal and natural that I use every day that just flows. Like there's a gap in my knowledge from what's comfortable and flows and from what I need support with. So I have the policy for all of the drips in my email. And whenever I have a patient that has to go on a drip, the very first thing I do is I pull up the policy and I look at the reference. So I know, oh, okay, now I just had to give norepinephrine the other day. So I know, okay, I can start at 4 mics per minute and I can titrate every 3 to 5 minutes, 1 to 3 mics per minute. And my goal is to have a systolic greater than 90 or a MAP greater than 65, greater than or equal to. So now, because I just used it recently, it's still here. But if you ask me that another week from now, I can't guarantee that it's still going to be here, right? It's not knowledge yet. It's not knowledge that I can count on yet. So my advice to you is don't consider yourself stupid. Don't consider yourself failing because you will die before you know everything there is to know in the profession of nursing. And as quickly as drugs change, as policies change, as the science changes, what you knew to be true yesterday might come out tomorrow as not being true, or something new is replacing it, right? Like we used to use Coumadin all the time. We would give Coumadin on the floors, we would draw INRs, we would be double checking, we would be adjusting. We almost rarely use Coumadin anymore. Like Plavix or Eliquis is a lot more popular these days. So what used to be true, what I used to be very comfortable with, has now been replaced with something different. So be comfortable and flexible and just recognize that I'm always going to have a knowledge gap. Now, the key is if you ever have that question in your gut, like, I don't know if this is the right thing to do. I do not 100% confidently say, this is why I'm doing it. This is why the patient's requiring it. This is the safest, best thing to do for my patient in this moment, because then don't do it. So here's another example. I had a patient who came in with new onset atrial fibrillation in a rapid ventricular rate. And we did get him to convert into a normal sinus rhythm, but the doctors wanted to put him on amiodarone, which made perfect sense because the heart is still very labile, right? Like it could flip back into atrial fibrillation at any second. However, the kicker is that even though he converted, he was still incredibly hypotensive. He was sweating, which in my experience, usually once they convert into a normal sinus rhythm, their pressure rebounds back to normal. But that was not true for him. And I kept thinking in my gut, like, gosh, it's been a long time since I've given an amiodarone bolus followed by a drip. I know it's the right thing to do because of the atrial fibrillation and the RVR, but I'm not feeling good about how low his blood pressure is. Let me go give myself a refresher, right? Let me go refresh my knowledge. Let me go look up amiodarone again. Let me go look up the contraindications. Let me just refresh myself. Like there's something in my gut, like trust that goes back to know thyself. Know how to trust your gut because your gut is always right. Whether it's pointing you to something that's going to be dangerous or it's pointing you to a gap in knowledge or skill, trust it. Just learn to trust it. And sure enough, it was contraindicated in hypotension because it can cause hypotension. So I just made a little note like patient's hypotensive, holding amiodarone for now, paged out to the admitting physician and the cardiologist, right? Like this is my part saying I know he needs it for these reasons, but this is also my gut and what I just filled in with my knowledge gap saying I don't think it's the right decision for right now. And I'm going to run it by a physician before I just go ahead and check that box, right? So let me just encourage you to know that even though they're asking you to check a box, it doesn't mean the box is always right. And know that it's okay to have a knowledge gap and to lean on your resources and to ask questions. And if anybody ever makes you feel stupid or tells you you're failing as a nurse because you asked a question, cross them off the list of allies. Just say thank you very much and know that they're not somebody you're going to ask a question to in the future. Go find a better ally who's going to support you in getting those decisions. Okay. Tip number 5, last tip, know your opportunities. Now, in the course of nursing, you have to do CEUs, right? There are things that you have to learn every year to keep up your licensure. You have to have continuing education units, but also within your department or within your hospital, the educators are going to be constantly offering new opportunities to learn new skills, new knowledge. For example, in my department, we have an educator that's always offering how to use the hand-heavy system for codes. We did one recently on uh, pediatric sepsis and all the different types, and we did one on pediatric diabetic ketoacidosis. And we are constantly having reps come in and teach us how to use new devices. Like I had never used a Lucas. Like I didn't know what a Lucas was. If you don't know what a Lucas is, it's an automated device that does CPR for you at the correct rate and the correct depth. I had to learn how to use that because I'm old school. Like you put 2 hands on a chest and you go to work, friend. That's what I learned. So I'm learning new technology every single day. And what's really cool is that you used to have to pay a lot of money to learn. but your hospital is actually going to pay you to fill in that knowledge gap. So I highly, highly, highly encourage you to take advantage of the educational opportunities that the educators are offering. Or if you have a specific knowledge gap, something that you or have questions about something you'd like to learn about, take that to your educator, because your educator not only can teach you in real time and point you towards tools and resources, but they also have the power to create a learning opportunity around your needs. But they don't know that unless you go to them with your needs, right? So, just in recap, number one, you're not failing. If you're struggling with thoughts that you are failing, just know that you're not alone and that if nobody else sees you, I do. And you might wonder, like, you don't even know me. How can you see me? I can see you because I was you, and I can see you because I am you. I have gotten feedback that I'm not doing things right. I have gotten feedback from people that are not my allies. I have gotten stuck in feeling like a failure because I couldn't hit an IV on a 5-day-old baby multiple times in a row. I have felt like I was a failure because I didn't know something that a nurse with my experience should know. I've been caught in that trap. I see you, I hear you, I am you. I am not a failure, and you are not a failure. Okay, so know thyself, know your allies, know who you can go to, know your skills gaps, and be willing to go find those resources to grow in the skills that you need to do the job you were hired for. Know your knowledge gaps, know where to find the education, the resources, the policies and procedures, as dry as they are your very best friend when it comes to doing things the way the hospital wants you to do. And here's a hot tip: the more you can do things according to the hospital's policies, the more a hospital can have your back if one of your charts ever ends up in court. If you cannot say, here's how I follow the policy, the hospital cannot have your back. And that's just an unfortunate truth of the way the systems are set up. So know your knowledge gap and know where your resources are. And lastly, know your opportunities and take advantage. Until the next perfect time, much love, Coach Jess.